Dr. Santhi Vardhani, Yashoda Hospital, Secunderabad. I am a general surgeon, colorectal surgeon and a proctologist. Today I want to talk about women and hemorrhoids. So in the women, why the hemorrhoids are most frequently seen? The first thing is the hormonal changes in the body. Regular cycles before periods, usually in the women, there will be some constipation because of the hormonal changes, premenstrual changes of the hormones in the body can cause constipation in women, which can cause straining during the periods. And after the periods, usually again the motion will be softer. If anything which is causing straining, patient has to take laxatives, that is stool softeners, without any hesitation. If the motion is hard, patient has to take stool softeners. In the woman, particularly in the premenstrual phase, constipation will be there, and in the pregnancy, sometimes early days of the pregnancy, there will be lot of vomiting, nausea, cannot able to take not even liquids. By that, the patient can develop constipation. That means hard stool. Constipation means not only passing irregular stools once in 2 to 3 days. Daily passing hard stool is also a constipation. So if anything in the pregnancy, constipation is there, patient has to take stool softeners. Patient in the pregnancies, usually they take calcium more because it is needed for the baby development. So calcium can cause constipation. That means hardening of the stool. Post delivery also, during the lactation, that is in the breastfeeding phase, calcium is required. So usually we supplement calcium for at least 6 months in a feeding mother. That time also patients can develop constipation. For every constipation, there is no need of taking stool softeners. It is dietary changes and exercises are very much required. If it is not happening with the dietary changes and exercises, then patient has to take the stool softener without any hesitation, because in India many people think that if we take the stool softener, it will be habituated and addicted. It is not like that. Why can't we take stool softeners if the stool is hard? So think about it. It is not an addicted or a habituated thing. And after the pregnancy also, in the women, in the perimenopausal age and menopausal age, there is a lack of calcium. By that supplementations we are regularly giving. In that phase, we have to give stool softeners. And multiple pregnancies, by that the fetus, that is in the pregnancy, the baby will press the intestine. So by that the motility of the colon, that is intestinal motility, will be obscured, and by that the stool will be lodged, and after that, after some time, the stool will become very much harder and wider. So the opening may be not sufficient to pass that stool. At a few times it may happen, so we need to address that problem also. Particularly in the females, usually in the countryside, they used to take lot of pickles and a lot of spices, so which can cause digestive problems. By that, if the outlet is not properly going out, then there will be a reflux disease upside and patient will develop gastric problems. They think that it is a gastric problem. It is not the gastric problem, it is the digestive problem because of what you are consuming, what you are eating. So take care of eating habits, add plenty of fruits and salads in your diet, and probiotics like natural probiotic like curd and yogurt and buttermilk. These are the natural things. Spending lot of time in the toilet, that means many people they get time to sit on the commode and they won't come out for quite a few times. So it should be changed. Whenever the nature call is there, then only has to go there and sit and empty the bowl. Without nature call, by the time like 8 o'clock we have to go to the office, so by this time we have to finish. So without getting a urge also, patients are going to the toilets, and they are straining a lot to get the bowel emptied. So it is not a good habit, because females will have lot of schedules so to prepare the kitchen and everything, so children, so they are not giving proper time for the toilets. So it is also very much needed. Hydration is very much needed. Now the summer is coming, so we have to concentrate on rehydration. Otherwise there will be a problem in the stool, and it causes, even though it is a simple problem, whenever any problem related to the stool, just come and ask your physician. By that they will address it. If it is not happening, see a proctologist, that is colorectal surgeon or a general surgeon. Thank you.